there, this is Teresa Hitchcock, and I'm an art therapist with Tri-County Mental Health on the school-based team. And today we're going to be talking about ways we can reclaim the term social distancing and transform it into being physically distant but emotionally close, whether that's an in-person classroom or a virtual one. And as an art therapist, I like to share art activities. So we're going to be talking about the research from Dr. Bruce Perry, and his findings really gave me some ideas for ways that you can use art materials to manage your own self-care and then give that stability to students during the challenge of COVID-19 pandemic. With everything being unpredictable and unsure, we really have such a huge job right now as the caring adults in kids' lives. One of my favorite findings that's really easy to remember from Dr. Perry's work is regulate, relate, reason. It's a really simple sequence of ways to approach a challenging situation in relationship. So if you have a child that's dysregulated, maybe they're upset, they feel challenged by all the challenges we have now, finding ways to really help them first feel seen and related to before reasoning. As educators, you have such an important job to share that didactic information in the classroom, but finding ways you can incorporate social and emotional learning will really help your students be onboarded to be ready to receive that important information that you have to share. So Dr. Perry is a researcher on childhood trauma and a neuroscientist. So he really talks about the way that we take in stressful information, traumatic events, like a pandemic that we're all collectively sharing, and how our bodies really regulate the way that we process that information. And the antidote to that, of course, is relationship. And so as teachers, you have a very important job. He has some really great videos out since the start of the pandemic that are free on YouTube. I'll have a link at the end. And in one of them, he talks about emotional contagion. And that's where what I'm feeling translates to the people around me. So kids have that BS barometer that's off the charts, right? They can tell when you're faking it to try to make it, really it's when you can really be real and feel what you feel with them that they feel seen, they feel heard. And having that transparency is really regulating and normalizing. So while it's a challenging time, but what we have at our disposal as adults with our frontal lobes fully developed is the ability to really take a step back from looking at the stressful situation and see what we have control of. So we have the ability to take care of ourselves in the best way we can. And that act of self-care, because of emotional contagion, is an act of community care. So today I'll be talking about how we can use creativity to help regulate our own nervous system. And then whenever we're in relationship with kids, they'll feel that regulation as well. I'll be sharing some regulating activities that you can use art materials for. So sensory fidgets that you can have on Zoom or at the desk, some mindful doodling, weaving, and then some ways that we can relate to our kids. So combating Zoom and mask fatigue. I'll be sharing the tips that I've kind of gleaned from Dr. Perry's videos. And then a really simple postcard collage that you can make with students to really bolster that connection that you have with them, that they have with each other. So before becoming an art therapist, I was a teacher myself, and I really saw this pattern that Dr. Perry illustrates in one of his videos of co-regulation. So whenever I would maybe come out of a stressful faculty meeting, and then I'd go right into the classroom and carry that stress with me, my students would rise up with me in my level of stress. And luckily I was an art teacher, so we'd be, fidgeting with yarn, we'd be making marks, and I would see the kids calm down throughout the class, and myself too, as I engaged in those art activities as well. So that's what really brought me to art therapy. And when I got to school, I found Dr. Perry, and he said, oh, that pattern repetitive activity that you are dosing throughout your day is really regulating, and it helps you feel a sense of calm and a sense of regulation. So it could be even flipping the pages of a book, encouraging your kids to go pet an animal, having that repetitive activity, taking a walk, is really a way to kind of regulate yourself, and that whenever you're the adult, the children will follow that suit. And so anytime that you can take a minute throughout your day as you're teaching in this stressful pandemic to dose a little bit of regulating activity that's patterned and repetitive, you're going to help yourself come down on the stress level, and then your children will follow suit. So having a way to kind of come back into your body and move and engage your senses is a really great way to regulate for yourself and for your students. So finding ways to encourage them to have a fidget that fits their needs. So for me, I love this putty, but maybe it's a spinner. Maybe it's having a cat on your lap to pet. Maybe it's having a drawing across the room that you can look at. Any way that you can light a candle or drink a sip of coffee, those are ways that you can engage your senses and kind of help come back into your body rather than be in a frazzled sense, that feeling of being out of your body. Another great kind of way to have that patterned repetitive activity is to kind of doodle and draw. So those repetitive marks that you make, you can encourage your students. They don't have to be keyed into Zoom the entire time and have eye contact. That's really stressful, as you probably well know. And so anytime they can give their eyes a break is a really great moment that they can be in their body making some marks while still having auditory input from learning in the classroom. So the last regulating activity is the craft of weaving. In this, I incorporated a little bit more sensory input with a cinnamon stick. I lit a candle for myself. There's lots of texture to feel, patterned repetitive activity, and going from left to right, right to left, left to right, encourages that bilateral input. So you're engaging both sides of the brain, both sides of the body. And this is a really great activity if you might be, as an adult, or a lot of time teenagers are kind of nervous about their drawing ability. So there's no like real talent you have to do this. It's really about engaging with the process and the materials. So I used a simple piece of cardboard recycling, cut slits in the top and bottom in an even spacing, put some yarn around it, and then you can use a paper clip really easily to make a kind of shuttle to pass the yarn back and forth. And this is a really great, really low cost, easy way to have a fidget on hand that engages a lot of senses and is a patterned repetitive activity. So as I've watched these videos from Dr. Perry since the pandemic began, he has lots of advice for ways that we can help model self-regulation when on Zoom, but also in the classroom with a mask on. The 20-20-20 practice is where every 20 minutes on the screen, you encourage people to take 20 seconds to look 20 feet away, to give the eyes a break and a chance to really refocus and not have that intense visual input. It's really regulating to a system. Anytime that you can model self-regulation, so maybe you have a fidget or you're normalizing that need to get up and move. So giving frequent breaks, saying, okay kids, we're gonna take a 5-minute break. I want you to do 20 jumping jacks, or take a walk around your room, find a pet to pet. And those ways that you can really find ways to connect in smaller groups. So we're going to kind of transition into going from regulation to relating, that next step to help kids onboard and be ready for learning. So I don't know about you, but when I go to the grocery store and everybody is wearing a mask, I feel really isolated. I'm constantly looking around for visual clues of what's everyone thinking, feeling, relating to, and that's going to be happening in the in-person classroom while wearing masks. So any way that we can be creative to send the message to our students that we see them, that we are smiling at them, they can feel our acceptance, our warmth, is really great. So I encourage you to find creative ways to do that. So this last art activity in our relate category is a way that we can send the message that we care and have a tangible evidence of that for our students. So using really simple materials, a cereal box, a magazine, scissors, and glue, you can make a postcard if you're over Zoom, or even in an in-person classroom where you have to physically distance. There's a tangible way that you can have evidence that I'm emotionally close to you. So Maybe a student has a best friend that's sitting on the opposite side, they're 20 feet away and they can't interact. They can make those notes to each other and say, I care about you, I see you, I miss you, this is hard, but we're in this together. And you can do that for your students as well if over virtual. So sending a postcard in the mail is a really simple way to have that evidence that a student is really held by you as a teacher. I want to thank you for spending your valuable time with me today. This is by no means an exhaustive list of art activities of Dr. Perry's research. I encourage you to find those free videos online. They're really encouraging and normalizing that what we're going through is difficult right now, and it's unpredictable, and we have a very little control over what's happening. But he encourages everyone to find those things that you can control, and I hope that you are able to go and dose some self-regulation throughout your day and your students' day, and find ways to engage with the creative parts of the brain to really help engage the body and feel calm. Tri-County's emergency crisis helpline is here if you need it, and there are lots of other great resources. And again, at the bottom here is the YouTube series from Dr. Perry. I hope that you all are taking good care and feel lots of support and connection throughout this time, and I hope this has been encouraging for you. Take good care.